Hi, my name's Dean R. Silver, MD. I'm a cardiologist and I'm an integrative physician here in Scottsdale, Arizona. And I want to talk to you a little bit today about conditions that I treat. And this is on the website that I'm sure all of you can look at. And I specialize in chronic complex disease. So let me go through you with a little bit so you get an idea of what I do. I do stem cells, and that's stem cells from your own body. I do autologous harvesting from bone marrow as well as fat cells. I'm under certain IRBs from the FDA, and they include for Alzheimer's, for multiple sclerosis, for Parkinson's, for joint and pain, and many other things, including fragility syndrome. So if you have any problems like that, I can really help restore your stem cells, which is your natural healing process in your body. Now, next we do integrative cancer, and as you know from my other videos, I'm a cancer survivor. I had cancer in my chest in 2000, and I cured myself alternatively. And we do testing from Europe that actually tell me how to cure your cancer, what chemotherapy works. It'll give me the cure rate. It'll tell me 50 different natural substances like green tea and curcumin and vitamin C. I can also look at circulating cancer stem cells. I can also tell you how much cancer in a drop of your blood. And we could start from testing from there. Now remember, circulating cancer stem cells, as New England Journal of Medicine article said, it's a liquid biopsy. And this predicts remission as well as prognosis. So I do a lot of alternative therapies for cancer. Under an FDA study, I do intravenous ozone. I do IV cocktails such as Myers cocktail, glutathione, phosphatidylcholine. I do ultraviolet blood irradiation. So I think things like this, along with heavy metal detox therapies, raising your immunity, killing virus, and personalized genomic cancer therapies are very, very important. Now remember, traditional allopathic medicine does not have this approach. So it's your choice. You can look at your cancer genes. Now remember, all cancers are different. Okay, all cancers have different genes. So we'll look at all your genes, we'll see which are up and we'll see which is down, and we can manipulate this. So cancer can be a chronic disease, and we could just treat it like high blood pressure and cholesterol, but we're using a targeted therapy. Now the next thing I am, you know, an integrative cardiologist, so we look at metabolic cardiology. We look at why you have heart disease, why you have cardiomyopathy, why you have heart failure. We look at the underlying reason, and we look at then things to improve your cardiac function, your contractility. I specialize in cardiomyopathies and heart failure cases. So whether it's stem cells, whether it's heavy metals, whether it's just building up the function of your heart, I into all that. And I use hormones for that. I use growth hormone and testosterone, and we use a product called Neupogen to raise your own stem cells. Now, the next thing I'm into is prolozone for pain. And I first had my own back issues for years in the cardiac catheterization lab. And my doctor did ozone injections in my back. So now we're in an FDA study for prolozone injections. And you can learn more of that on my website. Now, as far as intravenous therapies, very, very important. And again, we tailor-make those therapies to what your blood tests reveal. And remember, your blood tests don't lie. So we do IV cancer therapies, IV phosphatidylcholine, IV Myers cocktail, IV ozone, IV ultraviolet blood irradiation, and a myriad of other energy and immune-boosting IV therapies. We also have a full complex of anti-aging medicine. We do autism, autoimmune disease. I do breast health. We have an FDA-approved thermography camera. I do detoxification. We do diabetes, obviously fatigue and fibromyalgia, food allergy testing, gastrointestinal evaluation, bioidentical natural hormones, infertility, kidney disease, liver disease. I'm a specialist in Lyme disease. And for anyone listening, I'm a Lyme literate physician. You can go Google that, Lyme literate physician. The difference between me, I like to tailor-make the therapies based on the test. And again, that's where the ozone and the ultraviolet light comes in, so I can kill your Lyme. And sometimes even without antibiotics. We can bring up the immunity of the body. Macrogeneration, mold. Again, remember, I've had mold. I grew up in a moldy house. So we raise your immunity, we can kill off the mold. We do neurologic stuff. We do chronic brain diseases like multiple sclerosis, ALS, Alzheimer's, and Parkinson's disease. We do neuropathies, obviously obesity by increasing detoxification, peripheral vascular disease, prostate disease, stroke and traumatic brain injury, and obviously thyroid. So all you out there with cold hands, cold feet, brittle nails, dry skin, constipation, high cholesterol, obesity, we can fix that. So the essence of this is complex chronic disease. It's to know your biochemistry. It's to know what your Krebs cycle, to know your metabolic rate, to know your hormones, to know your toxins, to know your heavy metal load, to know your infections, to know your immunity. We start with base packages, and then we look at peer-reviewed scientific results, and we personalize based on your genes, the therapies. Again, we treat complex chronic disease. Why? Because I'm a cancer survivor. I'm a heart attack survivor. So if you understand what I'm saying and you want to join me and you want to learn about personalized medical care and you want to take control of your destiny and we'll develop the healthcare partnership, I'm the one to call. I'm the one to call. Please look at my website. It's deansilvermd.com. That's DEANSILVERMD.com. Please call me at 480-860-2030. I can help, but it starts with a phone call. Thank you. Hope to hear from you soon. Best in health.